Our next speaker is Peter Farnham. He's Director of Government Relations of the Nutrition and Metabolism Society. Peter.
Thank you, Sally. Well, thank you, everybody. My name is Pete Farnham, as Sally said, and I'm the Director of Government Relations for the Nutrition and Metabolism Society. I only have one slide, and so I'm going to put it up here, and you can read it at your leisure during my remarks, which will be brief. We are happy to be here today in cooperation with the Healthy Nation Coalition. The Society provides research, information, and education in the application of fundamental science to nutrition. The Society is particularly dedicated to the incorporation of nutritional biochemistry when considering problems of obesity, diabetes, and cardiovascular disease. The Society does not advocate any specific dietary strategy for healthy people of normal body weight. However, the Society holds the view that the therapeutic potential of low-carbohydrate diets for the treatment of obesity, diabetes, and cardiovascular disease is underinvestigated and underused. The Society has reviewed the federal government's 2010 Dietary Guidelines for Americans. They are unclear and overly long, but worst of all, the recommendations are not in accordance with the evidence. Thus, new guidelines are required. A new, more broadly based committee is also needed. In the meantime, the current committee should openly discuss the current recommendations with everyone who's interested, including their critics. We are very concerned over the federal government's continued adherence to the same basic advice the USDA and Health and Human Services have been advocating since 1980. This fact, along with the structure, recommendations, and even tone of the document, implies that there is no nutrition problem in the United States, and yet the document itself notes that obesity rates have skyrocketed, along with the metabolic problems that accompany that condition. Clearly, there is a major disconnect between the guidelines and the problem. In short, the guidelines are not working. Indeed, the Society believes that the guidelines, through such recommendations as the one on page 15 of the guidelines, if you have that copy, in table 2-4, that 45 to 65% of one's daily caloric intake should come from carbohydrates. They're making the problem worse. The increase in calories in the obesity epidemic has been almost entirely due to increased consumption of carbs, and the only people who might be reasonably expected to eat a diet so high in carbohydrates regularly are competitive athletes, marathon runners, people who are getting a lot of aerobic exercise every day, and that's clearly not most people. There is not so much as a footnote in this table cautioning that this advice might be completely inappropriate and even dangerous for people who are obese or sick. This gets to the most fundamental problem in the guidelines. They imply that a single overall food strategy is appropriate for most Americans. The fact is, no single approach to food works for everyone. And the Society holds the view that if you are healthy and of normal body weight, you have developed your own diet that is apparently working for you, and thus one must ask, why are there dietary guidelines for people who don't have a problem? Conversely, since much of the population is insulin resistant, has diabetes, or is obese, guidelines for these people would be much more useful. To produce such guidelines, however, a much broader panel of expertise is needed. To address seriously the problem of rising obesity and diabetes rates, the Nutrition and Metabolism Society has several recommendations. Okay, one, the National Institutes of Health, the National Institute of for Food and Agriculture, or some other appropriate federal agency should conduct an objective, well-designed 5-year clinical trial of the therapeutic effects of carbohydrate restriction on people who are obese or suffering from metabolic syndrome or type 2 diabetes. The designers of the study must include researchers who have demonstrated the benefits of carbohydrate restriction in their research. Science does not run on majority opinion. Researchers in carbohydrate restriction are a minority, but have appropriate credentials and have demonstrated results. Second, new guidelines aimed at people who are obese or sick are needed and should be designed by a new, more broadly based committee. In the meantime, the current committee should discuss the current guidelines freely and openly, including with their critics, to provide information for the future. And third and finally, the Nutrition and Metabolism Society is going to request to meet with senior officials at USDA and HHS, as well as members of the committee, to discuss these guidelines and our concerns with them. Everyone will benefit from open discussion of the guidelines, including, most of all, the American people. I'd like to close with one final quote that I wanted to mention. Richard Feynman, a very prominent member of our society, has said, and I quote, "The deleterious effects of fat have only been measured in the presence of high carbohydrate. A high-fat diet in the presence of high carbohydrate is different than a high-fat diet in the presence of low carbohydrate." Okay. Thank you.
Thank you, Peter. And I want to echo his concerns that there has been no dialogue or debate with the members of the committee. When we went to testify, which was part of the mandate that they could have oral testimony, there wasn't a single member of the committee there. And we have asked the committee to have a debate with people who are concerned, and we've had no reply to that either. So this committee operates in a vacuum. The only contact that we had with them was to be able to listen to their webinar. The public was not even at these meetings. So there definitely is a wall between the committee and the rest of the community.